Uh, Good evening, friends and colleagues. Welcome to our monthly call and webinar conversation with our Riverside County Public Health Officer, Dr. Geoffrey Leung, who has been very helpful to the community and physicians. With his expertise and hard work, we get to know the latest, and any help we need, he's always available. Uh, Dr. Geoffrey Leung, good evening, and I'll let you first give the update, and then we'll go to questions.
Thank you, Dr. Singhvi. So just some general updates from a county perspective. Probably as you are all feeling, the COVID numbers are improving. We've seen a steady decline in the number of new cases, in the positivity rate, and in hospitalizations over the past several weeks. Right now, we're seeing about 2,000 new cases each week. Our positivity is at 5.2%. Our case rate is at 13.9 per 100,000. Our total COVID hospitalizations are at 282 with 74 in the ICU, and that's less than half of what we were seeing back in August. In terms of our overall vaccination rate, we now have 66% of all of our eligible individuals in Riverside County 12 years of age and older who are partially or fully vaccinated. And in that group, 59.2 are fully vaccinated. And then in our seniors 65 years and older, 78.5% of them have been fully or partially vaccinated, with 71% of them fully vaccinated. We did want to share that there are a few sites within Riverside County that are now providing monoclonal antibody treatment. One of those locations is a state-sponsored site at the RUHS Medical Center. And in case people are needing a place, to refer their patients and you don't have a place that's closer, the phone number for that MAB treatment center is 951-486-6520. Again, it's 951-486-6520. So that is a state-sponsored monoclonal antibody treatment center. There are a few events and kind of milestones in the schedule that may be pertinent and helpful for all of you to just kind of be reminded of. The first is tomorrow is actually a key day for schools. All school teachers, staff, and volunteers starting tomorrow will need to either provide proof of vaccination or submit to weekly COVID testing, just like we have in healthcare. So that school vaccination and testing mandate goes into effect tomorrow. And then you've probably all heard that the governor announced at the beginning of this month on October 1st that all California students will be required to provide proof that they've had their COVID vaccine the term following full FDA approval of the vaccine for their age or grade span. Meaning if someone's in the 7 to 12 grade year span or the K through 12 grade year span, they'll take those in blocks. And they'll need that in order to attend school. So this is different. This is one step beyond the EUA approval, and functionally, we're probably looking at least into the next academic year and not this school year. I think people have been following closely the news about boosters and the pediatric expansion of the Pfizer vaccine. Today, the FDA met, or the advisors to the FDA met, and they did advise that the FDA authorized Moderna as a booster at half the dose at 50 micrograms to be given at least 6 months after the second dose for certain populations that are paralleling the Pfizer booster population. So those 65 years and older, those who may be at high risk because of an underlying medical condition, and those who may be at high risk because of an occupation. So the next step is tomorrow there's another the second day of the FDA meeting to review the data for the Johnson & Johnson booster. And then next week on the 20th and 21st, the CDC will have their meeting to look at the data and potentially give a recommendation for guidelines. So functionally, that means as early as October 22nd, if everything receives the green light, we could be giving boosters for Moderna and Johnson & Johnson. In terms of the Pfizer vaccine for those 5 to 11 years of age, we've heard a lot about that in the news. So Pfizer did officially submit an emergency use authorization application. And there's an FDA meeting scheduled on October 26th to review the data, and then a CDC meeting scheduled on November 2nd and November 3rd. So similarly, if every thing receives the green light in those meetings, we could potentially be giving vaccines, Pfizer vaccines to our kids 5 to 11 as early as November 4th. And of course, if there's any hiccups, it could be later. And right now, what they're looking at is at a dosage that's 10 micrograms instead of the 30 micrograms that we use for adults. And then finally, we did want to highlight that Merck announced just 2 days ago that they are seeking emergency use authorization for an oral antiviral called molnupiravir. And that is supposed to be for individuals with mild to moderate COVID symptoms. It may prevent worsening of the symptoms as well as hospitalization. So those are some of the things that we just wanted to touch on. And thank you, Dr. Singhvi, and thank you to the group for making time this evening.
Thanks, Dr. Leung. We go to questions now. The first question is, with COVID-19 cases on the decline, it appears the Delta variant surge is about over. Is it possible Riverside County is attaining a substantial herd immunity due to vaccine adoption and natural immunity due to past COVID-19 cases? Is RUHS tracking any new variants of concern that may have an impact in our community?
Yeah, so great question. So to the first question, we definitely do believe that we're in a much safer place now because 2/3 of the eligible population, is at least partially vaccinated. And, there should be some additional protection from recent infections. However, we believe, we probably need to get that percentage up, even higher before we will see a loosening, an additional loosening of restrictions. In terms of, new variants of concern, Riverside County is sort of tracking the variants in the same way that the state is. At this point, really the only variant that is significant is the Delta variant still. That's making up nearly 100% of the tested samples. But we will continue to monitor and let all of you know if we learn of anything different.
Dr. Leung, I heard that the new Pfizer vaccine will have sort of effectiveness against Delta variant. Is that true?
So that's what I have heard as well, but I wouldn't be able to speak to that in more detail.
Okay. Our next question is, what are valid reasons to issue a patient a letter of exemption from the COVID-19 vaccine? How would you recommend we respond to patients who are not a candidate for an exemption?
Yeah. So, just from following all of this, my own bias is that there are probably very few situations in which a patient actually could not receive a vaccine. And of course, if if someone is allergic to a component of the vaccine, that would be a good reason. Historically, we have seen doctors who are taking care of cancer patients or who are taking care of pregnant women who have seemed to suggest that, maybe their patients should wait. But really, when you look at the CDC guidelines and you look at the data, these types of individuals would fall into the groups that are more vulnerable, both to COVID as well as to complications related to COVID. So, we think the reasons for a letter of exemption for the vaccine are probably very few and far between. And if you are not comfortable or you think that it is not medically indicated, we recommend, just stating that very candidly. We don't think that you would be a candidate for exemption, or in your case, it doesn't look like you would meet the criteria for being exempt from the vaccine. And certainly open to what types of scripting has worked for other people.
So how about a patient who just got out of the hospital from COVID sickness about 10 days ago? He's ready to work and he's not yet a candidate for vaccine. Is it a ground for exemption?
So if someone has recently had a COVID infection, depending upon the reason for the vaccine. So if they fall into a working category where they're supposed to be vaccinated, that recent infection could buy them some time before they have to, be vaccinated. And certainly, you could write a letter that says, my patient has had a recent COVID infection starting this date. But after the period of isolation, and if a patient is doing better symptomatically, they can go ahead and receive the vaccine.
Thanks. Next, is masking still required for everyone in the office if everyone is vaccinated?
So this depends on a few different variables. If we're talking about a healthcare setting, then yes, masking is still required for everyone. And CDPH has actually outlined certain settings where masking is always required. The state has made a universal recommendation for indoor masking, but sites such as healthcare facilities, schools, shelters, correctional facilities, public transportation hubs, those are all examples of locations where masking would always be required, regardless of vaccination status. And then, outside of that, it would next depend upon people's vaccination status. So Cal OSHA, essentially states that, if you're not in one of those settings where everyone's required to wear a mask all the time, if you're, say, in a business center and you are unvaccinated, then you need to be wearing a mask to sort of protect others as well as yourself. So I don't know if that answers that question.
Thank you. For healthcare workers who do have a vaccine exemption, how often do they need to be tested? As a best practice, do you recommend regular testing of vaccinated employees due to the possibility of breakthrough cases?
So great question. So, according to the state health order regarding the vaccine mandate for healthcare workers, there are two pathways for exemption. One is a medical exemption and one is a religious exemption. If you have healthcare workers who have a valid exemption, then they need to test according to their site. Acute care hospital as well as skilled nursing facility workers generally need to test twice a week. And then in general, healthcare workers in all other settings, including outpatient settings, need to test once weekly. In terms of the second part of that question, this is a good question. And what we've heard before is, we're starting to see some breakthrough cases. Should we be more aggressive about testing, vaccinated individuals? At this point, when we look at the overall positivity rate in Riverside County, again, it's about 5.2%. This includes symptomatic individuals, those who are being tested because they're exposed, et cetera, et cetera. When you look at that, we do know that vaccinated individuals are testing positive probably at about 1/30th of the rate as unvaccinated individuals. So, the rate of positive tests that you would expect from, testing vaccinated employees should be very low. Now, the one exception is if you have a vaccinated employee who's symptomatic, then we would absolutely recommend testing.
So how about, I was told that individuals who have taken flu vaccine are less likely to get COVID. Is that true?
So, there were some initial studies suggesting this. I don't know that we have something definitive enough to say that is true. I think we've had some larger studies showing that, if you get your second dose of COVID vaccine at the same time as when you get your influenza vaccine, that you're not at any higher risk for having adverse events, and that the immune response for the COVID vaccine and the influenza vaccine look adequate and sort of as we would predict. Beyond that, I don't know that we can say much, with a lot of confidence.
Thank you. Next, how is county handling COVID-19 vaccine mandates, suspending unvaccinated and non-compliant testers? Are there any upcoming mandates or loosening of existing mandates to be aware of?
So to start with the second question, we do not know of any upcoming new mandates or a loosening of existing mandates. We do know that November 1st is an important milestone because the California Department of Public Health said that they would reassess or reassess the masking requirement before that time, as well as the masking recommendations. Our own feeling is that it's very unlikely that they will change the masking requirement or remove it. Regarding the first question, in terms of the county, for county employees who fit one of those categories in which there is a vaccine mandate, such as healthcare workers, the Riverside County is following the state requirements. So, the state has basically said after September 30th, if you have individuals who have not been vaccinated, who do not have an exemption, they should not be working. So, we've tried very carefully to make sure that people either fit into an exemption bucket or that they're in the process of getting vaccinated. And if they're not, then we've sort of given them kind of that notice that they're not able to. We're essentially kind of giving them a directive that they need to be. So we're following the state requirements on that.
Great. Next, children with any symptoms, cold, etc., while in school are asked to go to their PCP to get a clearance to go back to school. PCR tested or quarantined. I always tell my patients to get tested before I give them clearance to go back to school. Is that within normal or over testing?
So this is a great question, especially, in anticipation of this winter, and we're starting to see a rise in, coughs and colds. So first of all, this approach in asking your patients to get tested for COVID, we think is a good practice because most school protocols, and you can ask about, the specific school district, of interest, but in general, school protocols will generally say that symptomatic individuals who have not been part of a COVID exposure do need a negative COVID test before they can come back to school.
I see. Next one is, what documentation is acceptable when an employee requests a religious exemption from the healthcare worker vaccine mandate? How much investigation should a practice do when it is likely the employee has provided false information?
So, employees who are requesting a religious exemption, who are healthcare workers, are not mandated to provide certain information. And this is really up to the employer. So the employer does have the right or the ability to confirm or sort of, verify in their own mind from their perspective whether an exemption makes sense or is valid. And beyond that, there's not much guidance. So what we see in practice is quite a variety of practices. Most employers, what we see is they're not really pushing back when employees are asking for a religious exemption. But the other end of the spectrum is there are some employers that do ask for, a letter from their faith-based leader, or may, ask for a justification.
Now, I'm done with my questions. Dolores, are you there? Do you have any in chat box? Is Dolores there?
Yes, I'm here.
Good evening.
Good evening. And there are a couple questions in the chat box. The first one is, do we have a good sense of the most common side effects of the vaccine? We hear a lot of anecdotes about a wide variety of chronic ailments after vaccination.
Mm-hmm. So, I would say that what we've seen from the VAERS system through the reporting of side effects is fairly similar to what, we saw in the original applications when the vaccines were first getting emergency use authorization. And in terms of the more chronic symptoms, I don't know that we have enough I don't know if there's enough that's been substantiated to say what is absolutely, related to a vaccine or not.
Okay.
And I will add one more piece that, there's a difference between what is reported to VAERS as a potential side effect or an adverse effect versus what's actually confirmed. And a good example of that is, if someone believes there's a vaccine-related death and they report that, then there's an investigation that happens afterwards, and only a fraction of what's actually reported, is usually determined to be potentially related to the vaccine.
Okay, thank you. So antigen tests or kits, in terms of efficacy versus the regular PCR, is one superior to the other?
So great question. So we do know, the PCR is really the standard and has the highest sensitivity and specificity. And tests work fairly well, especially if an individual has symptoms, or if the antigen tests are used in a layered fashion where people are getting, once or twice weekly testing. They work fairly well for picking something up.
Okay. Does testing for variants still have 5 to 6 week turnaround time? What percent of samples are being sent for sequencing from Riverside County?
So, the turnaround time, I would guess is still at about a month. And it is still a very small fraction of the total tests done in Riverside County that are being sent for variant testing. The state has been trying to kind of augment that testing capacity. But at this time, again, all the variants that are coming back are really coming back almost 100% for, really 100% for Delta.
Okay. Next question, can healthcare workers who do not fall in the high-risk category take a booster, Moderna or Pfizer dose, if it is going to be wasted?
So this is, I guess, a nuanced question, because a healthcare worker, first of all, already qualifies for a booster. So if a healthcare worker received Pfizer or Moderna, an mRNA vaccine, and received their first 2 doses, and they're now at least 6 months out from their second dose, they can receive a booster. So that's already according to the CDC guidelines. If they're in a high-risk category, they would also qualify a booster, but it wouldn't put them ahead of the healthcare workers. And finally, the only situation where a healthcare worker who has an underlying condition might be able to get an additional dose even sooner is if they have a condition that qualifies them for being moderately to severely immunosuppressed. So that's something like if they've had an organ transplant and they're on immunosuppressive therapy, and those individuals can actually get an additional dose 1 month after their second dose instead of having to wait 6 months.
What do you think of Singapore experience? They all were vaccinated, and now their antibody levels are going down, and they are succumbing to COVID infection, though maybe to a minor degree of sickness. Do you have any comments on that?
So a couple general comments. So the first thing is, we know the CDC has been very clear to say that we cannot make too many inferences from antibody levels. So, we suspect that antibody levels are important, but they're probably not the only, pathway or mechanism, for immunity. The second piece is, in Israel, there were some similar occurrences, and people were concerned about sort of waning immunity and increasing infections. And this is why, we started talking about a booster potentially for the general population. However, when the data for the United States was reviewed, what we saw was that clearly the vast majority of hospitalizations and deaths occurring related to COVID are still happening in unvaccinated individuals. So it may be that, vaccinated individuals at a certain point start becoming more susceptible to mild or asymptomatic reinfection. But really, when we're looking at serious illness, hospitalization, and death, the vaccines, at least from the US data, suggest that they continue to be very protective. And when we look at our vaccinated versus unvaccinated data in Riverside County, again, about 90% of all the hospitalizations are occurring in unvaccinated individuals, and about 97% of all the deaths in Riverside County are occurring in unvaccinated individuals.
Dr. Singhvi, one more question came in the chat. If we have time, I see we have 2 more minutes. Okay. Next question. Does the acknowledgement by California that all school K-12 guidance around COVID are just recommendations, not mandates, other than masking, have any implications for healthcare workers and settings? This is in reference to the briefing for them, quote, let them breathe, quote, case against the governor.
So for those not familiar, this is a great question. There was a court case in San Diego brought on by the Let Them Breathe parent group regarding mandatory masking in schools. The group lost their case regarding mandatory masking, but the state provided a filing that said essentially that what is in the CDPH guidelines, the school K-12 guidelines, are recommendations, and that schools can choose to implement them or not. That was stated by, I believe, a deputy attorney general. Since that time, we've had discussions with other health officers and with CDPH, and we have all been operating under the understanding that these were requirements. And that's how we've conveyed that with our schools. And this opinion is, has generally been shared up and down the state. So when this was brought to our attention, especially through both, concerned parents as well as superintendents, we actually escalated this back up through the California Department of Public Health. They heard loud and clear from all of the health officers and health directors that, to suddenly say that all of the guidance regarding schools is not required, is very confusing and problematic, and can potentially have a ripple effect in other areas, in other guidelines. They are now working on a statement that will clarify, a clarifying statement. So they will be posting that hopefully in the very near future. I can share that at least in Riverside County, we continue to operate under the understanding that these things are required. We continue to say that isolation, quarantine, and testing, are really important strategies that we expect schools to follow them. And in a superintendent's call as recently as yesterday, what we also heard is there are, it could be potentially problematic for school administrators to suddenly loosen requirements without taking into consideration other things like Cal OSHA, which includes quarantining requirements, bargaining agreements with teachers' unions, school safety plans that have been mandated regarding COVID, and a variety of other issues. So great question, and we are waiting for clarification from the state.
If we can say antibody is not a good way to monitor immunity, as there are other factors like memory cells which can contribute to immunity, what is then the objective way to define good immunity, and how are we defining good immunity?
Yeah, so what I anticipate, and this is just reading into a crystal ball, is that once we have enough data on people who've been tested, who've had antibody levels checked, and data on subsequent reinfections, that we will then have more guidance on what would be considered an adequate level of antibodies. Because we don't have enough of that data, that's why the CDC continues to remind us that we really cannot use the antibody test as a way of verifying immunity.
Thank you. My thanks to all the attendees. Thank you, Dr. Leung, for your expertise and wisdom. You have been a great resource.